So I'll be talking about neck pain today. If you have no experience with a horse with neck pain, you probably haven't given it a lot of thought. But as soon as you've seen one, you suddenly realize it's everywhere. Well, I might be exaggerating a little bit, but still, neck pathology is more common than we think. And part of the reason that it is so underestimated is because there is limited research into it. So the prevalence, causality, and location of cervical lesions are all scarcely documented. And because we don't know a lot about it, diagnostics haven't been researched. And if you can't diagnose it, you don't really know that it's there because you can't test for it. Today, I will be talking about neck pain, what it is, what can cause it, and what you can do or we can do about it. I'm not going to be giving a ton of scientific references because it's just going to get a bit tedious. But if you are interested in reading a science backstory with all the references, I really recommend reading Nicole Rombach's PhD work and basically every paper written by Sharon May Davis. They're just amazing and they really are worth the read if you're interested in research. So before we crack on with the presentation, need to change the slide, yes. I'm going to give a very concise anatomical overview of the equine neck so we know what we're talking about. Yes, that's the one. Brigitte posted the name in the chat from the PhD work. So the anatomical overview. Because when I started writing, I never gave anatomy any thought. I just saw a horse with a neck, back, legs, and not what's inside of it. So it was quite a shock when I found out that the vertebrae are actually on the bottom side of the neck. In my defense, I was 7, so that's maybe why. But still, I was really surprised when I actually saw how the vertebrae were inside of the neck. So the neck consists of 7 vertebral bodies, and it makes up 10% of the entire horse's body weight. So as you can imagine, a structure this heavy, so far from the body, needs a lot of stability to maintain its position, but it is also used to move and help in functions during gait and transferring of weight and even breathing. So it needs a lot of muscle power and coordination to do that as well. How do they achieve all of this? This is achieved through 3 systems. The first one is the form of the vertebrae. You can see it here. They all fit into each other very neatly through the articular process joints and the intervertebral joints. The second system is a muscular system. So here is it's only one of them. Is a picture of the superficial muscles. They are the ones that are mainly in charge of movement. So muscles on the outside of the body will create movement. The muscles deeper to the vertebrae will achieve stability. So that are the main stabilizers, the one that are next to the bodies. And the main ones in the neck that you need to think of are the multifidi and the longus colli muscles. The last system is the ligaments. Ligaments are the ligaments. This one actually already brings us into the area of explaining why so many horses have neck pain. So as you can see, there's a red line all across the spine, and that's called the Nuchal Ligament. And it's got 2 parts, a funicular part and a laminar part. And in all the pictures we have or drawings of horses, the laminar part is connected from the funicular part to every single vertebral body. But in recent research, we've seen that it's actually missing at the last 2 vertebrae. So C6 and C7 don't have that part of the ligaments. So you can already imagine that can cause some issues regarding stability. And this is speculated to be one of the main reasons why we have so much osteoarthritis in those C6 and C7 joints, because if the ligament's missing, there's micro movement in between the joint because it's just not stable enough, and this causes overuse of the joints and early wear and tear. Okay, so let's get into prevalence of neck pain. It's a nice picture of C6 and C7, and you can just see the first rib as well in the left-hand corner. So neck pain is not as straightforward when trying to document it in the equine population as it is in humans. Because, of course, humans can just say, I've got neck pain, and you can put that in the statistics, but we can't do that with horses. So one of the only ways of knowing for sure that the horse is suffering from it is seeing evidence of the pathology through medical imaging, alongside seeing improvement after treatment. Why is that second part so important? Because just as in human medicine, you are not your MRI, so you can see, or your X-ray or whatever, you can have pathology present without having complaints. So about 60% or even more of 50-year-olds, humans that is, of course, have herniated discs without pain. So it's not because there is something wrong that you have pain. That's why I think it's important to see that alongside the changes you see in the anatomy, that there is also improvement after treatment. And of course, there has to be signs of pain or discomfort. When neck pain is suspected, it can be treated conservatively, and this may have good results, but it's not possible to scientifically prove that the cause of loss of performance is due to the neck pain. So that's why it's a lot harder to prove that there's neck pain without anatomical changes, whereas in humans, we can prove that, and we see that as well, that there is pain just because there is a muscle dysfunction, but it's very hard to document that in horses. So there are studies looking at the amount of horses with neck pain, but this is almost exclusively focused on the presence of pathology in combination with symptoms of pain, loss of performance, or neurological symptoms. To give you an idea of how hard it is to quantify it, it has been reported that the prevalence of back and neck pain in the general equine population ranges from 2 to 94%. So 2 is very little, 94 is just massive. Of course, that depends on the horses they use, but it's still a lot. In contrast to that huge amount, I was talking to a first-line vet the other day, and I was just asking her which clinic she would recommend going to in Belgium if you suspect neck pain or have an orthopedic problem. And she said, she recommended one certain clinic in Belgium, and she said that they believe in neck pain as well. So it was just mind-boggling for me that there are clinics that still don't believe in neck pain. Well, when you see that some studies find 94% of their horses having neck pain. Okay, so another one, this is C7 with the first rib and the first thoracic vertebrae. So because there is limited research in the equine field, and because anatomy and biomechanics are fairly similar to humans, researchers and clinicians tend to draw evidence from human literature to form hypotheses. In humans, the main causes of neck pain are whiplash-associated disorder, so that's traumatic, chronic articular process joint pain, so that's your APA joints, and degeneration of the intervertebral disc. That's similar to herniated discs. And they have also seen that when pain is present, the cross-sectional area of stabilizing muscles, so the mass of the stabilizing muscles, is decreased. And in human neck pain, this is where treatment is aimed at, increasing the motor control and activity of these stabilizing muscles. I'm of course telling you this because this is what we believe is going to help us with our horses as well. The cause of neck pathology in horses can be traumatic, degenerative, or congenital. So degenerative means it's like wear and tear. Congenital is that they're born with it, or it's genetic. So due to the high prevalence of lesions, because in studies they have found a huge amount of lesions in all the horses, it could be that in many horses, those osseous changes are unrelated to pathology and mainly caused by degeneration. So that's age, which is normal, because they also see that the prevalence increases with age. So this is what I was talking about earlier, that it's not because you take an X-ray and you see damage that there has to be pain. So in horses, possible joint pathologies of the neck range from osteoarthritis, osteochondrosis, so that's cartilage damage, and facet joint degeneration, to synovial cysts, but also cervical vertebral stenotic myelopathy, which is a long name for wobblers. So I think that's fairly, most people know wobblers, so that are the really ataxic horses that stumble and have very little power in their hind limbs. So that's one of the most documented diseases when it comes to cervical arthropathy, and they are often believed to be the result of osseous lesions. So what causes CVSM or wobblers is often due to degeneration. There is more bone that's going onto the joints, if that makes sense. So it's a bit, osteoarthritis is actually extra bone growth on top of your joints. And that causes for the passage for the nerves, that it becomes smaller and smaller. So there is compression onto the nerves, which causes ataxia and weakness. Yes. Lately, there has also been new research done by Sharon May Davis. I've mentioned her before. I might have a little celebrity crush, but she really has amazing papers out there. And that's about ECVM. So that's equine complex vertebral malformation. And that was first seen in cows, but they were always stillborn if they had it. But horses live with it, which means we also breed with those horses. And in her preliminary research, she found that 30 to 35% of warm bloods was affected with this. I think she did it in Australia, so if you're in Australia, you're extra screwed. No, it's in all populations. To give you an idea what this vertebral malformation is, it affects the 6 and 7 vertebral, and one of the you can see all the bumps on the vertebrae, and one of them, of the C6 vertebrae, is gone. It's just not there. Sometimes it will be transposed onto the 7th vertebra, and even the first and second ribs can be affected. Of course, this not only sounds really gruesome, but it also has a lot of biomechanical effects, because the little bump that's missing, it's called the caudal ventral cubicle for the therapist Sandra from us. And it is an anchor point for the longus colli muscle, which I already mentioned, which is a stabilizer, but also a mover. So if that part of the bone is missing, the muscle will have to attach elsewhere, which can lead to altered and asymmetrical biomechanics. If you then combine it with the fact that every horse misses a part of the ligament at that level, the horses affected with this condition, they struggle so much with trying to stabilize that area, just because, well, they're missing the ligament, they're missing one of their main stabilizers, and the spine is just not looking like how it should. On top of that, it can also cause compression of the trachea and even trap C8 and T1 nerve roots. And if the ribs are affected, it can even lead to inconsistent front limb lameness because it influences nerve passage. So that was a brief insight into pathology of the bones. Then we're going into the effect that it can have. So from human literature, we have learned that when a person is in pain, the global mobilizers tend to take over from the deep stabilizers. So the global mobilizers are the one we see on the outside. The deep stabilizers are the one close to the bone. But this leads to muscle overuse because the global mobilizers are muscles that are designed to perform strong action for a short amount of time and create movements. Whereas the small stabilizers, the deep stabilizers, they are designed to work constantly, but with a minimal effort. So if those movers have to take over and work constantly, they'll get overused. And this is when you see really tight, hard muscles on top of a neck or somewhere else in the body, and even muscle strains. To give you an insight in human literature, because again, equine is really limited in this area. They found that people with neck pain and lower back pain had decreased motor control and atrophy of postural control muscles. So postural control muscles, again, are another term for those stabilizing muscles. And that's why I picked this picture as well. As you can see, this horse, not a perfect position while riding either, but she's got like a hole in the middle of her neck. And this is something you see often in neck pain, that point in the neck is atrophied. So the surrounding muscles are hypertrophic, which means they have overgrown. And in the middle, there's a lack of muscle because they are inhibited and they're not working because there's pain at that level. Of course, if they're not working because of pain, the horse can't use his neck right, and it'll keep on using the wrong muscles, which just cycle. On top of that, it's not only causing overuse of the cervical muscles, but it also puts more strain on the facet joints of C6 and C7, possibly causing inflammation, and long-term it can cause osteoarthritis. If there is an underlying pathology like we talked about before, this will spark on the pathology, create more pain, and cause even more problems. So you can have a horse in training that's actually doing fine, but underneath there is pathology present. So there is a malformation or osteoarthritis or whatever is present, but because the horse is moving well, working well, he's using his body right, he's actually actively stabilizing that area and making sure that the inflammation is not triggered. If you take a horse like that out of work and you put it back into work, that's when you often will see injuries, not only in the neck, but SIJ joints as well, kissing spines, all that kind of thing, because their active stabilizers have weakened. And when they start working again, they'll start using those global mobilizers to try and maintain the correct position, leading to the symptoms you will then see. Is that everything I want to say? Yeah. If I'm going too fast, just let me know. Okay. So this was a little introduction into everything you needed to know before we get started. So let's have a look at symptoms. The clinical presentation of cervical arthropathy can really have detrimental effects. They can cause loss of performance or lameness and even lead to neurological conditions. Main symptoms associated with it are an atypical carriage of the neck. So a lot of extension is often seen, or difficulty side bending, stiffness, pain, ataxia, the atrophy I talked about, formal lameness, lack of stability. So that's why I pick this picture. If you have a horse that's slightly neurological and you start lifting a limb and then pushing it gently to one side, it will fall. Well, it will stumble. Don't push it so hard it falls, please, when you're trying this. And it's often like an intermittent forelimb lameness that people don't really know what's causing it. It's just certain moments that you can see it. That's often radiating from the neck, because when a horse has to do a tight circle or extension of the neck, that's when you will see the fore or even hind limbs becoming irregular or even lame. Another one that's often present is hypermetria. If you don't know this, it's that the horse is lifting one limb higher than it should or higher than the other. So this, again, we often test in small circles because this exacerbates the symptoms. And a lack of proprioception. So the horse doesn't really know where he's putting his leg. So that's why he'll lift it higher to make sure he clears the ground. His control is just a bit off. So they'll give a lot of action into giving the leg a lift, even more than he should, or tripping the opposite, not clearing the leg high enough because he just doesn't know where it is. In severe cases, it can even cause inability to stand. So if it really is blocking all the nerves, there is a fracture jamming there, it could be that it's just totally paralyzed. There are also less obvious symptoms. So the unstableness I was talking about, you won't really see that with riding. You cannot easily just put it off on weakness. Or even just an unwilling horse to work. So a loss of impulse is something we often hear. So people have a horse, it's going well. Something happens and they suddenly feel like the horse doesn't want to work anymore. They can't get it forward. And that's actually a very typical one. So it's just a slight change in behavior, or it's getting more grumpy, doesn't want to work anymore. And that's something that we hear often. So people are just as a last resort because the vet says it's fine, or as a first resort, just they feel something is wrong or off and they want to have it checked. And that's often how we find it, because he just doesn't want to move forward anymore. Behavior-wise, so apathic behavior, bad temper, acting out, so bucking, rearing up, stuff like that, biting. There are all signs that something is bothering your horse. So I always think an owner knows his horse the best. So if you feel like something's off, trust your guts. So don't go to someone and if they say, well, no, it's fine, you should just put him more forward or teach him a lesson or whatever. If you feel in your gut that there's something wrong, trust yourself. It's your horse. You know him best. When it comes to neck pain, one telltale sign I always look for is the amount of muscle in the neck. As I showed you on the previous picture, there's almost always atrophy. Of course, not in the first stages, because that doesn't happen overnight, of course. Also, if your horse trips a lot, of course, it could be hoofs, it could be another issue, but always think about the fact that it could be neck as well. Another important thing to keep in mind is pain. So this was another one of my big revelations, or so to say, was realizing that some horses that I had seen when I was a kid, people were just saying they had behavioral issues, they were grumpy, or they were slow, old ponies, whatever. But actually, in retrospect, they really shown signs of pain. So when I learned about the equine pain phase, it really opened the world for me. And this is actually proven to work. So the one that's showing now is the horse Grimace scale, but there's also the pain phase. And this is a scale where you can grade your horse, as you can see. Let's have a look at the pictures. And they're often subtle signs, but if you look at them, I think everyone has seen them in a horse. And this has actually been proven to work. It's been checked with heart rate monitors and everything, and temperature, that these are signs that your horse is in pain. That doesn't mean that if he has one of those signs that there's something wrong, but if he has multiple, this is really a warning sign. For the ones interested in research, this one is the horse Grimace scale from Da Costa, and this is by Glirup, the equine pain face. Okay, so if you recognize these symptoms, you think your horse is in pain or just feels off, what is the best way to find out he really has neck pain? At the moment, there are no objective, reliable, and valid assessment techniques for cervical arthropathy in the horse. So clinicians are forced to use subjective tools with poor or moderate inter-rater reliability. To increase this reliability, the combination of several tools offers the best chance of diagnosing the correct pathology. So a vet will usually take a lateral radiography and ultrasonography of the facet joints as well. I think for a physiotherapist or another therapist, after anamnesis, the most scientifically backed tool there is palpation of the painful segments. So your therapist will look at muscle tension, muscle bulk, and reactivity to pain on palpation, and also check range of motion and how your horse reacts to that. So this can be done actively or passively. Well, passively is not possible in horses, but as passive as we can. So we'll check how much can he bend sideways, how much can he bend into flexion, how much can he extend, and we'll keep an eye out for how he reacts. So if he's painful, he tries to avoid the pressure, or if he leans into it, which is a big difference, because a neck can be stiff but not painful. So they'll lean into it if it's stiff because it's annoying, but they won't back away like when it's pain. A correct diagnosis is crucial for the right treatments and to offer the horse the best chance of optimal recovery. So we really do need more scientifically backed medical imaging. But I think that at the moment, if you have a good orthopedic vet, they should be able to get the diagnosis right with x-rays and ultrasonography. But it is difficult to find a good vet. As I said in the beginning, a lot of vets don't believe in neck pain, and they'll see an x-ray and they can misinterpret it because it is very hard to read. So you really need to have an experienced clinician for that. So once you have a diagnosis, we're on to treatment. Treatment will obviously depend on the type of pathology as well as the functional restrictions that it has created. I'm going to discuss the veterinary options for treatments, but usually if there's inflammation of the facet joints, there will be corticosteroid injections into those inflamed sites. And after that treatment, physio comes into place. A picture of me physioing. So please keep in mind that it's not in your horse's best interest to go experimenting with what I'm talking about now. Always seek guidance from a trained professional, and they will explain to you what you can and can't do. So even if you're in doubt, always contact a professional and go on from there. So in the case of neck pain, physiotherapy has 3 main goals. First of all, decreasing pain, get that horse as comfortable as possible, as fast as possible. Then we want to increase mobility. And when we have established that, we want to increase stability and motor control. These last 2 points can be turn around. If you have a horse that has instability of the last or other vertebrae, which is quite common as well, you're not going to want to increase mobility because, well, if the joints are unstable and you create even more instability, they could subluxate and cause nerve damage. This is why don't go experimenting on your own. In that case, we will want to create stability instead of mobility. So step number 1 is decreasing pain. We have 2 main tools for that. One of it is myofascial work to decrease muscle tension. And the other one are mobilization techniques. But there are different degrees of mobilization. So in this first step, we will use very slight oscillatory mobilizations. And it's quite different from the other ones because they actually send a soothing signal to your brain. So it's sort of like a natural painkiller sending signals to your brain. It's fine. There's no pain here. So those 2 techniques we'll use to start out with. And once that's done, we're going to try and increase mobility. And mobility will be increased by decreasing muscle tone because a tight muscle will block movement. And then we will go into the mobilizations more and use slower movements, but push a bit more through into the joint movements. So how can I explain this? So if you have a joint, you have a range of motion, and it's divided in different degrees. So you have your first and your second, which are very superficial. And then third and fourth are really going into the end of range of motion, which is where we'll want to work if you want to create more motion. And then you have the last degree, and that's a manipulation. Yeah. So that's the second step, increasing mobility through that. And the last step is increasing stability and motor control. And this is done through training and consistency. Yeah, this is the most important part. I'll talk about this most because this is where the owners come into play. This is something that has to be done regularly and consistently to work. So a physiotherapist is there to just help you create the right environment, actually. So a physio is not going to heal your horse in one session, but it will allow your horse or the body of the horse to perform the right movements so that it can heal himself. Yeah, so I think that in many cases, although I have seen that Vitality Equine goes against the stream here, often body workers and therapists alike stick to manual work and sort of creates a dependability with their clients. And this is where I believe that the difference with a good therapist lies, is that they believe in healing through movement. So we will create the environment, the loss, so decreased pain, no more muscle tension, no articular blockages, so that then the owners can go into training the horses in the correct way, which I've seen if you follow Vitality Equine. They post their own stretches and exercise for the owners to do, and that's really the way to go, because that's going to make sure that the horses will remain symptom-free for the rest of their lives. To explain this, I'm going to work with 2 cases. The pictures I've used are not from those horses, just to ensure their privacy. So I've been working with 2 horses over the past months. And in an ideal situation, they would have been sent to secondary line vets, so diagnostic clinics to get x-rays. But due to personal circumstances of the owners, that was not an option. I'm not advocating this line of treatment per se, but it was nice to see the results nonetheless. Yeah. So I'll use these examples to describe how I go about treating neck pain, or at least how I do it at the moment. So both horses were not neurological, but they had serious range of motion problems in the cervical spine. They had very high muscle tone, they were in pain, and they were showing problems during riding. Obviously, or well, as usual, it's the last one that causes them to call the physio. So they were experiencing problems during riding, and that's when they call for help. When there is pain present, we always want a vet to check, but as I said, in this case, that was not an option. But that does create ethical dilemmas, like if a horse really is in pain, should you treat it, yes or no? In this case, or in the first case of the young horse that I'll be talking about, I chose to treat it because they weren't going to go to a vet, so I wanted to try and do something than just let it be and have him be in pain without any help. I treated both horses manually, but during the first treatments, I didn't work on increasing the range of motion because I wanted to decrease the pain first. I also taught the owners exercises so they could actively increase range of motion, but also activate the right neck muscles and to increase motor control. I've seen a few posts as well from Vitality Equine using baited stretches. And if any one of my clients are listening, I am a huge fan of this exercise, as they probably know already. I don't really use it as a stretch. I always ask my owners to do these exercises as often as they can, every day or every other day, but preferably before they start working the horse, because I think it's a great exercise to recruit the correct muscles, warm them up, and induce correct side bending. So yeah, I use it as an activation exercise. I do this with human patients as well. So people with knee pain often have knee pain because they have weak glutes, gluteals. So I ask them to activate the muscle before they start running. And that usually goes a very long way. And this is actually what I want to do with my neck pain horses as well. So horses with a range of motion restriction into lateral flexion will compensate into rotation. So when you do the baited stretch, they will rotate immediately. I'm going to see, here's a picture of it. This horse, I didn't perform it quite well, but you see he's just rotating. He's not side bending a lot, he's just turning his head. Yeah, back again. So when you're doing the exercise, make sure you do it really slowly. Preferably place your hand on the atlas. That's the big bony part right behind their ears. So you can guide them and keep their ears above their nose. This picture isn't perfect either, but this horse is quite hard to do it with. So do it slowly, just go to where they can handle it, and you can do it you can just do it more each time, and they will progress. It's better that they don't side bend a lot than that they side bend wrong. By doing this frequently, they will start to incorporate this movement pattern into their movement grammar, so to speak. So by facilitating this movement, this will become natural for them. So they will stop using that rotation in their daily life. And these exercises have actually been shown to increase the size of the stabilizing muscles, which is a bonus, obviously. So circling back to those cases I was talking about, the first one was a young horse, and he had so much trouble getting into work. He lacked impulse, he was weak, he didn't build up muscle at all, he had difficulty cantering, and he was really tough in his mouth. And he especially deteriorated after he was taken out of work. So he was struggling, but then he got a break of a few weeks and he was just terrible. So I think they put him on rest for 5 weeks due to personal circumstances. And they thought he would be quite active because it was just being fed through like usual. And they got on him and he just didn't want to go forward at all. On top of that, he had an altered feeding position because they're used to being out on the field all the time, but it was winter and the fields were so bad that wasn't an option. And his new feeding position asked for a lot of rotation, so he's actually always eating with his head turned. So when we looked at him then, he was just so painful, a lot more than before he was taken out of work. And as I said, this is where I would always send to the vets, but that was not an option now. So we decided to start a training program. I started with decreasing muscle tension, which is usually the horses like, but he was so painful that it was, he was so painful. It really had to start slow. And I treated him often. Usually we go about treating every 4 to 8 weeks, but with him, I did weekly sessions just because we had to work so slow to decrease the tension in his neck. I did gentle mobs as well. And then I gave them a training program. We also changed their trainer. So we asked them to work with the anatomically correct training. I don't know if any one of you have heard of it. But it asks for the horse. It doesn't force him into a certain position if that's too high or too low, but it respects the way that his neck is built. And then we started increasing strength as well. We changed his feeding position, got him out walking outside more again because luckily the fields cleared up. And that's how it went. I'll show you a picture of the muscle tension. So you can really see on the left picture, it's like a taut band of the splenius muscle. That's just so tight and painful. And on the right side, you can see it as well. So interesting is this horse adopted a low position with his head very often. So he just stand there with his head close to the ground because that relieves the tension of those muscles. So we also decided to do a very slow warm-up with this horse because when starting riding, he was always so stiff and sore, and if they tried to push him through, he would just not get better. So they would always start with 10 to 15 minutes of just walking on a loose rein, a bit of big loops and turns. And then when starting to trot after this, just letting him decide the pace. So if that's very slow, then it was very slow. And just focusing on activating that inside hind limb. And once he got stronger in that, we started to increase his pace and his exercises, and he got a lot stronger as well. So at the beginning, engaging the core and building up the back muscles were the main focus when riding, together with trying to engage those neck muscles. So those trainings, they were not exciting at all for the rider, not for the horse either. It was just walking big circles, activating that hind limb, making sure he was using his core, maybe some pulls on an exciting day, but it was not a lot more than that. And for the first 4 weeks, they did not even canter because he was just so weak that he couldn't adopt a good position. So it's just useless putting him through that. And slowly but steadily, the muscle tone decreased and eventually even resolved. And the horse is a lot more supple and reactive during riding. So he's doing a lot better. He's getting stronger and nicer to ride. And he's getting more active. He's not the slow down depressed horse anymore. But it is important to mention that as soon as the rider or the owner stops doing the exercises, he deteriorates really fast. So this is a very promising result, and then I think it's a really nice case to see, because this is not usually what you see. Normally you would have seen this horse go to the vet and then get corticosteroids injected or whatever that was, what's wrong with him inside of his neck. And then we get to do some physical therapy. But now you can see that even with something more severe going on, we can still go a long way with conservative treatments. So this is not an issue that was just fixed by the manual therapy, but it is really the exercises and the training done by the rider that just made him into a nicer horse with less pain. Oh yeah, here's him compensating, or another horse compensating. Our second case was a 22-year-old horse that was rescued 2 years beforehand in quite a bad state. So she was just left on a field, and she was very skinny, and she had the typical broodmare posture, so sway back, no top line anywhere. She looked quite bad. They did feed her up, but they kept experiencing behavioral issues. So she was aggressive when saddling. During transitions into trot or canter, she would do like a little jump. She had difficulty bending, and there was a lack of impulse. So, of course, first step is always going to the vet. They treated her ulcers. They had the saddle checked. She'd been on painkillers. She'd been seen by an osteopath, and nothing seemed to work, or at least not long term. So the osteopath did do some good for a few weeks, but then she went right back to baseline. So after 2 years, the owners were getting pretty desperate. So when I went in to see her, she was really in pain. I think she had almost all elements of the equine pain phase present, and some severe blockages in the neck. Unlike the previous horse, our treatment plan with this one, we took her out of work completely, partly because her back was so bad as well. She had no muscles at all. And this was also a Western horse, so didn't really want to put on a heavy saddle and then have her riding with a back that looked so weak. So we took her out of work for a few weeks, only working on engaging those neck muscles, increasing range of motion, and installing a correct movement pattern. For this one, I also taught the owner some massage techniques so they could help relieve the tension at the pole, because this horse really reacted strongly to that and was feeling obviously a lot better when we just relieved the muscle tension to start with. So after 3 weeks, we scheduled another appointment after first treatment, and I'm a bit bad with time. So I thought I hadn't seen the horse for 5 or 6 weeks. So I arrive and I tell the owner how surprised I was at how much muscle the horse had built up already in her top line after 5 weeks, and she kindly reminded me there was only 3. So I really regret not taking before and after pictures, because it was just a different horse after 3 weeks. And to be honest, it was a really good owner. She went over there every day. She did exercises for the neck. She did sternal lifts for the top line and the core. She did in-hand training to activate her hind limbs. So she really did put in work. And that's, of course, what brought this horse to where she is now. After those 3 weeks, I gave her another week to settle in, because after treatment, we often want horses to rest a bit, so because they can be sore. She started picking riding up again, and after 2 weeks, she reported that the canter was improved and the transitions were without the jumps, or more or less. So once in a while, she would still jump, but mostly not. Which is, of course, a really nice result. And again, really advocates for putting in the work for your horse. What did I want to say? Oh yeah, important one with this one, and this is the last thing I'm going to tell you today, is that this horse, after the second treatment, she started riding again, and she only saw significant improvement after 2 weeks. And the reason for that is that horses have a sort of learned pain memory. So if they've been in pain for a long time, they sort of have to realize that it's learned pain behavior, that the movement that usually hurts doesn't hurt anymore. So horses that have had, I don't know how you say it in English, when they get really angry when you saddle them up. Yeah, whatever, you know what I mean. That horses that do that because they have an ulcer, that they keep doing it after it has healed, just because that's just how they learn to behave. So after treatment now as well, the horse had to realize that she could actually move her neck without it being painful. That's why it sometimes takes a bit longer, because they have to learn how to move their body again. Yeah, girthy. Perfect. Yes. So what did I want to say? I think that's about it.
That's awesome.
Oh yeah, one more thing. Yeah. Both horses, two of the main symptoms that were visible was difficulty side bending. So if you put them on a circle, they would always look to the outside and just really keep their neck really still. Alongside with when you put them on lunge, whatever you did, they would not budge. They would just go so slow. Their hind limb was at A when their head was at C. It was just kind of the picture you get a lot in neck patients. So that was my talk about neck pain. So if you have any questions, please feel free to ask.
Thank you, Charlotte, for that amazing presentation on neck pathologies in our equine athletes. I've dropped the contact info for Charlotte right here. Feel free to reach out if you have any questions about the presentation or about any other neck pathologies, whether you're a horse owner or a horse body worker. Reach out. She's an amazing resource. She does amazing research, works with incredible athletes, and we're so excited to have her as one of our Vitality Equine partners from overseas. So enjoy the rest of your day, and let's not forget about our horse's neck when we're working with them.